I'm Nikki Pai. I'm an assistant professor of clinical epidemiology and infectious diseases at McGill University and McGill University Health Center. My research has focused on point of care diagnostics, developing screening strategies with point of care tests for HIV and related co-infections for resource limited settings primarily. And my current focus is on self-testing and on multiplex strategies. I do research in several different parts of the world, and the only way it will reach people in different parts of the world is through open access. So more power to open access. Seriously, I mean, that's what it is. At the end of the day, you need knowledge grows by sharing. There's no other way in which knowledge is gonna grow. And all of these middlemen that are trying to take away all our hard work, they should not be there. So I'm really happy that governments are waking up to this reality, and there's so much of action on data sharing. So I'm not really happy about paying for data or figuring out who's going to, take ownership of that data, because we don't want abuse of data, right? So if we have to figure out some of those things that the human mind can come up with. I do not propagate or I'm not a proponent of something that I don't believe in. I think open access is the now and the future of scientific publishing. So anybody who doesn't believe in it is either delusional uh, or is really living in the past. One of the reasons why I believe in it is because I've experienced lack of access to top journals. When I was training in India, I could not get access to JAMA because sometimes the subscriptions would run out. I could not get access to any gem. So I heavily started relying on CDC, MMWR, and WHO, and documents that were put out by UNAIDS. So open access literature was almost like it was the jour for me. And they also put out a synthesis of literature, so that became very almost like I loved reading them compared to journals. When I got into reviews, I did Cochrane reviews, and thankfully Cochrane reviews are also open access, to the best of my knowledge. Yeah, so they were also widely disseminated. So, and that was the same time, around the time when I started publishing, PLoS was beginning to grow. So I was really happy that there was a journal that's really going to be open access and it's going to grow. So I think it started out by experiencing, the lack of access, and then wanting to really make sure that it doesn't happen to other people. And so, yeah, and really believing in the fact that knowledge is for sharing. Knowledge is not for hoarding. Knowledge grows by sharing. The more you share and discuss knowledge, the more it spreads. And open access is like a catalyst. It's going to help with knowledge dissemination. It's going to help permeate all sections of the society. It's going to allow somebody has a scientific inclination but is not a scientist or not a doctor or not a health professional understand what science is all about. And that's how science is going to grow. The old model of publishing, I heard about it even in great depth when I got the Open Access Innovation Award last year at the World Bank. So I came to know that in the old model, or the model that is also prevalent, publishers earn 40% profits from publications. And I thought that's way too much. I mean, none of our stocks earn that much in today's day and age. And look at the amount of hard work that goes into creating knowledge. How much work, how much of ours go into creating good knowledge. And why should middlemen, take money out of something that is really due to the people? So there should be a way of getting it back. This is all funded by people's taxes, all of the open science research and research by government agencies. So there should be a way to give back to the community. And open access is that conduit, it'll take from the people, give it back to the people. So why wouldn't it grow? I mean, it's just such a pure movement. I have heard that some key organizations do not have access to journals, top journals. So that to me is another I mean, how can that happen in today's day and age? So how can policymakers make evidence-based decision if they don't have access to knowledge? So that's how open access can help. By publishing in open access, people don't have to pay. They can download information, and they would be certain that this is peer-reviewed literature, and they will use it for their evidence-based decision making. So it kind of hastens the process of policy change. So you don't have to wait for years. It takes years to mount a trial. It takes years to get the findings. It takes years to get funded. At least the process of dissemination will be rapid. Right? That's why I'm so optimistic about the future of open access. I think open access certainly catalyzes discourse on key, and models like ScienceOpen are going to catalyze that discourse. Like key scientific findings need to be discussed and debated and critiqued and peer reviewed, but with a healthy dose of skepticism and a healthy sense of criticism. Oftentimes, good scientific findings, if they don't appeal to the collective intelligence of peer reviewers, right, they get killed. So that is not a fair process. So ScienceOpen allows that to happen, by making it by publishing it in the open, by allowing people to comment on it, by allowing people, giving them a chance to improve upon it. You not only are trying to create a transparent platform to generating good science, you're also helping the quality of peer review, which has been one of the important very key critiques of open access journals. Like their peer review is not very good quality, so you should publish in the non-open access journals, the closed journals, right? So that's that. So it takes care of the peer review process, so which is one of the key critiques of open access publishing, as we said earlier. So we know that it will help improve that component. The other component, I think it will be a sustainable business models, because we are looking for newer business models for open access that could be sustainable over time. So that's that. And then by providing an open scientific critique, I think it will help improve the impact factors, because some of the open access journals are always criticized or not having a high impact factor, though I can see that most of them are climbing now in their impact factors, because that is an important criteria used by tenure committees and also used by by the scientific committees for using all the the allowing all the publications to be presented. So all of these features will add up. And then I think one of the things that we could do better, we should actually talk about conflicts of interest with industry, and we should figure out a way to sift the grain from the chaff. It's really hard, but we should have a section for completely conflicted studies. It's okay to have that, like studies where there has been a certain level of funding, or they've been funded by pharma, and sometimes those studies are of good quality, so we should not really kill them just because they've been funded. But at the same time, we should have another section where we should have like two sections based on funding, and then it becomes easier to just look at the quality of science in them without being colored. But at the same time, there are these other studies that are kind of in the gray areas, and so we have to figure out a way to deal with those studies, because that I think is very we do a lot of meta-analyses, and sometimes we are not able to figure out whether the findings have been colored by the fact that somebody on the publication list has an overt or covert conflict with the industry. And is that a problem? Yes, it is a problem. If we really want to do good science, we should figure out how to draw the line between having a conflict versus not having at all, or being in the gray area. We have to address that. Nobody wants to address that, so I think open access journals can take that on. In terms of global implications, I see just growth with global implications. There's just growth. There's dissemination. There's impact on innovations when you allow science to spread, like TED Talks, for example. Even like 15 minutes, they talk about the latest advances, in so many different areas, and they influence so many people, so many young minds. So that is the essence of true learning. And I think if ScienceOpen stays true to its philosophy, it can certainly facilitate that, and it will. That's one of the reasons why I believe in it, the new model. And then I thought, because ScienceOpen has an innovative concept, I have two ideas that I thought would be useful. One is, if ScienceOpen could set up a section for young physicians and fellows, like I'm teaching a course here in clinical epidemiology at McGill to young residents and fellows and physicians. They want to publish, they are hungry, they're passionate. We need to tap into them. We need to give them an opportunity to publish their work, because sometimes they don't end up getting very supportive mentors, who give them a piece or allow them to share a piece of the sky. I give opportunities a lot, and a lot of my colleagues also that I know give opportunities, but some people I know, they don't want to give opportunities to their young people, and they are the future of science. So if ScienceOpen could have a section where these young people could publish their work without getting unduly criticized, but kind of being gently mentored into the scientific mainstream, I think that would be great. That would be like the ScienceOpen's give back to the community. And also a little forum for high school students and college students who are like all bright-eyed and open, and these guys are, they belong to the Facebook and the drone generation, so they are in a totally different league. So if we could give them a forum to discuss, what kind of ideas would you want, like they come up with wacky ideas which will probably transform science. So that could be, one of the ways in which you could do some more good. I think I always, when I give talks on open access, I always advise them to publish on open access. Some of them stand up and say that, we are worried because we want to, how do we, we have a lot of pressure to publish in non-open access journals because they have higher impact factors. So I kind of, I think there's a little bit of truth in that, but it's not the complete truth. So I said you should start out with with journals that you think are going to accept your paper. But if you get rejected, then there's no point in wasting time because you need papers. Then you should consider open access journals, and you should consider journals that are allowing you, like ScienceOpen, PLoS. There's so many good quality journals. So they should allow you this opportunity to improve yourself, and you should consider those. So certainly, young scientists should consider open access publishing. It's so easy because we need, we always say we need lines on your CV. So you need those publication lines, and so that will be great. In terms of my own research, I think my research is focused on creating strategies and models, and open access really helps catalyze all of that discourse on, how to make sure that these strategies reach populations and reach, empower individuals and empower communities. So if the literature is published in open access and there is a lay summary that accompanies it, right, then people from the communities that are scientifically inclined but are not so scientifically savvy, they can understand what you're doing and they can use it to make an informed judgment about what you're doing, right? And that's how you influence policy. That's how you don't waste time. The idea is to actually influence change through good quality science. So that's what it is. So I think there's great future. I just believe in that. So it'll happen. I'm really, really happy that this is a new model. It's self-archiving. It's going to improve peer review. So, I think it has a very good future. We just have to make it happen.